So we're here at the Medical Technologies Innovation Facility at Nottingham Trent University. And I'm here to talk about my research into heart transplant simulations. We've created two human hearts. One is a diseased heart, one is a healthy heart. The idea is that we have the diseased heart and lungs inside a simulated patient, and then the surgeon is able to cut out the diseased heart and stitch in the new heart exactly how they would in the real surgery. We use CT data from real patients and 3D print the components we need, and then change those rigid 3D prints into something which is soft and feels just like the real heart, looks like the real heart, and performs like the real heart when they're making incisions in surgery. So learning on a simulated patient allows the trainee to have that psychological space to make mistakes and learn by doing and be proficient, but also by recreating the visual aspect of the work. It allows the surgeon to be completely immersed in that procedure, psychologically, emotionally, and visually. Everything is as it would be in real surgery. The overarching research goal is to improve patient outcomes for heart transplant patients. And we can do that by providing safe models that are accessible to lots of people, to enable them to become proficient in surgery, fully understand what the surgery entails, and practice that until they're proficient.